Okay, so we're going to be talking about the neurodegenerative diseases. The neurodegenerative diseases are basically the disease that break down the nerve cells, and we have only three diseases that we are concerned with in our pharmacology section. The first disease is Alzheimer's. Alzheimer's is basically dementia, and there's slow onset memory loss along with progressive disorientation. And the drug that we need for Alzheimer's is an acetylcholine esterase inhibitor, and it basically will decrease acetylcholine esterase. And the agents that we use in Alzheimer's are donepezil, rivastigmine, and galantamine, along with memantine, which has a different mechanism of action. But to remember this drug, we need to remember the mnemonic that Dona Riva dances at the gala with Mema. So donepezil, rivastigmine, galantamine, and with memantine. So memantine is separate. So these three drugs work by inhibiting the acetylcholine esterase, and they are the first line treatment drugs. Only side effect which most of the drug causes nausea, dizziness, and insomnia, which is a very important side effect. So the patient has difficulty in sleeping and will present with progressive memory loss, so you know that they are on these drugs. And memantine is an NMDA receptor antagonist which helps prevent excitotoxicity mediated by calcium channel. And memantine is basically used for a moderate or a very advanced dementia, and the adverse side effect is that it causes dizziness, confusion, but this drug causes hallucination. So this one is not the first line drug, memantine. The next drug that we are concerned with is the amyotrophic lateral sclerosis. I don't know why my camera is not focusing. Okay, amyotrophic lateral sclerosis. It is a drug that weakens the muscle, and it is basically a disease that weakens the muscle and impacts the physical function. So there's muscle breakdown, nerve cell breakdown in this disease, and there is difficulty in physical activity. The drug that we use is a neuron is going to decrease the neuron glutamate excitotoxicity, that is riluzole. Riluzole for amyotrophic lateral sclerosis, it will increase the survival. The next disease that we're concerned with is Huntington's disease. Huntington's disease is basically a disorder of the basal ganglia, a disease affecting the basal ganglia, and the nerve cells break down, and the patient experiences Huntington's chorea, difficulty in movement. Huntington chorea is rapid involuntary jerking, writhing movements. The drug that we use for Huntington's is tetrabenazine, which will inhibit vesicular monoamine transporter VMAT, which basically decreases the dopamine vesicle packaging and the release. So there is decreased dopamine available, and it is a drug that is used for Huntington's chorea and tardive dyskinesia.